Have you ever caught yourself overthinking a situation, feeling so overwhelmed that you can't breathe? Sweating the small stuff so much that it's caused your body to feel a sense of fear and apprehension, and you begin to feel your adrenaline on overdrive. Have you ever heard the saying, if it won't matter in 5 years, don't spend more than 5 minutes on it? That's easier said than done for those suffering with anxiety. As humans, we tend to deal with stressful situations in life, whether it be work-related, school-related, a rocky relationship, kids constantly misbehaving at school. Those are the realities that anxiety feeds off of. From an article by the Anxiety and Depression Association of America, it is proven that anxiety is the most common mental health illness in the United States. The term anxiety disorder refers to specific psychiatric disorders that involve extreme fear or worry. It affects 40 million people ages 18 to 21 and 8% of children and teens are affected before the age of 21. In addition, according to the World Health Organization, 1 in 13 globally suffer from anxiety. The Department of Health and Human Services talks about 5 different types of anxiety. There's general anxiety, generalized anxiety, social anxiety, panic disorder, PTSD, and OCD. Now, my next question is, have you ever met someone that thinks that anxiety is made up in your head? If you're shaking your head yes, and you struggle with any kind of anxiety issues, then you probably get a little frustrated with those people. Because at some point in everyone's life, we all experience it. Whether it be from having to take a test, dealing with the loss of a loved one, running late for work, getting pulled over, making you even later, another call from the school about that rebellious child. Everyone deals with these things, but some are affected more harshly. It's a natural human response that comes with the day-to-day life. There are several risk factors for developing anxiety, according to Health One Patient Portal for Medical City McKinney, such as gender. Women are diagnosed twice as often as men. Reasons for this include hormonal factors, cultural expectations, and more willingness to visit the doctor to talk about their anxiety. A second factor is family history. Anxiety disorders tend to run in families. This may be due to family dynamics, such as failure to learn effective coping skills, overprotective behaviors, abuse, and violence. Substance abuse is also on that list of risk factors, stating that the use of tobacco, alcohol, and drugs can increase your risk of developing anxiety. A newsletter on Healthline stated some of the effects that anxiety has on the body, such as headaches, depression, irritability, breathing problems, pounding heart, loss of libido, upset stomach, extreme fatigue, increased blood pressure, and muscle aches and pains. There are several ways to cope and manage anxiety, such as using deep breathing exercises. Recognizing the symptoms of an anxiety attack can often be mistaken for a heart attack, so you need to know your symptoms. Closing the eyes, picture a happy place, engage in some light exercises, create a mantra to repeat to yourself, such as this too shall pass, I'm going to be okay. For those of you who do not know what an anxiety attack looks like, I found a video and I would like to take this time to show you someone who is experiencing an anxiety attack. Now that's just a few seconds. So that is the harsh reality of an anxiety attack for those of you who don't know. It's a normal part of life to experience occasional anxiety. But you may experience anxiety that is persistent, seemingly uncontrollable, and overwhelming. If it's an excessive, irrational dread of everyday situations, it can be disabling. When anxiety interferes with daily activities, you may have an anxiety disorder. Thank you.